Thank you so much. It's a really pleasure to be with you today, observing World Cancer Day. And I want to start by saying thank you to those in the room who work on this incredibly important issue, providing supports and information and counseling and advocacy on behalf of patients. It's a disease that touches the lives of many Canadians. Like many people, I've had many family members touched by cancer. My father-in-law has been living with it for 9 years. So it's a journey that really impacts a lot of families and can be a hard and anxiety-ridden road for families to travel. So the support that's provided by your organizations is incredibly important. Connecting people to information and advocacy and advice is something that really helps people down this difficult road. So thank you for doing that work. As we're observing World Cancer Day, the theme is closing the gap on care, which is incredibly timely, especially here in Ontario. I've been having a couple conversations with folks about the situation in Ontario. We know that access to routine screenings and prevention, early diagnosis and treatment makes an incredible difference in the outcomes for patients. But unfortunately, we're not seeing equitable access among patients. We're not seeing equitable access between types of cancers. So it's really important that we close that gap so that everybody has access to routine screenings, to preventative care, and to early diagnosis and treatment. Unfortunately, what we see in Ontario right now is that the situation is actually getting worse because 2.3 million people in the province don't have a primary care provider. That means they're not getting a routine screening unless there happens to be a clinic in their community. It means that early warning signs are being missed. You're not very likely to go to the emergency room and wait 12 hours because you're concerned about something that should be seen by a primary care provider. So it means that people are living longer with concerns, they're living longer in pain, and they're being diagnosed at later stages, which is more challenging for the patient. It means worse outcomes for the patient, more pain, more invasive treatments, but it also means it's more expensive for our healthcare system because people require more intensive treatments at that point. And unfortunately, we're also seeing in our hospital system really long wait times for surgeries and many patients exceeding the clinical guidelines for treatment for their particular condition, which again, worsens the impact for patients, means more invasive treatments, means worse outcomes, and means that we're losing people to cancer who could be treated if it was being treated at an earlier stage. So we really need to make the investments in our healthcare system to make sure that people are getting primary care, getting the routine screenings, but that the timely surgeries and treatments are there when they need them. So please know that you have an ally in me in fighting for this in Ontario, in fighting for greater equity between types of cancer. And thank you for the work that you do advocating for patients every day. Together, I hope that we achieve a scenario where every year we have more survivors because more people are surviving cancer, and down the road that we have fewer survivors because fewer people are actually developing cancer. So thank you very much.
So thank you very much for inviting me. My name is Laine Johnson and I am the City Councillor for College Ward. So we are in College Ward here right now, and I'm very glad to be sharing space with our MPP Chandra Pasma, who spoke so beautifully and so knowledgeably about the provincial experience and the provincial understanding relating also to a national scope of the impact of cancer for families. So I just really want to, it's a tough act to follow. Thank you for your attention to these issues. What comes alive for me is the energy in this space, in this room, in this event, because as the MPP said, this is a family diagnosis. And in this room, we're almost in a living room together, and we're sharing coffee and we're sharing, snacks, and we're sharing stories in a very informal way. And that feels like family for me. And so I think this is very symbolic for the way that people gather around a cancer diagnosis to plan and to strategize and to share the burden when someone is affected. And, from my perspective at the local level, certainly that community support is really what we're trying to work on within our local neighborhoods. I was very touched by some of Al's stories, you know, describing the advantages of peer support networks for supporting people with cancer diagnoses. Certainly, you know, we can't imagine, as you say, what it feels like, the isolation that is highly experienced when someone has a diagnosis, even as a family surrounds them. And so that peer support, you know, really again speaks to that that need for both close ties but also loose ties to support an individual and their loved ones as they navigate this. I was really, I mean, you have a tremendous leader here. I spoke with Jackie for, you know, probably 5 minutes and learned, you know, both the national priorities, the local priorities, the gaps that we're seeing. And so I'm sure that you are just a tremendous advocate for this organization, and I'm so glad that you're here. It was especially moving to me to hear sort of the impacts of COVID and the delaying of all of the, you know, screening and testing and procedures that are experienced by people. Similarly, I have a family member who, you know, has been diagnosed with cancer in the last so many years and has had very curious scheduling challenges when trying to seek treatment for that cancer, and the cancer continues to recur, and it does lead you to wonder what could have been if there had been, you know, a mindfulness. And how did you refer to it? You said cancer can't wait.
Yeah, that's
Yes.
our, I will talk about this a bit later, but we did 5 Leger surveys on COVID-19 disruption of cancer care. This is a report on the first 3, which looked at what the disruptions were. And the title is a comment that someone made in the open-ended questions. It was called, he said, "I feel like I've been thrown under the bus." And that's how many, if not most, cancer patients felt at that time. We're preparing, we have 3 reports on those 5, so we're preparing them for you in English and French, and for you in English and French as well. We don't print much anymore, but we thought we want those for when we go to meet with politicians, especially. We want those because COVID had such an impact on ordinary people.
Well, this is a beautiful segue, so I'm just going to say thank you for inviting me. And again, I'm looking forward to learning more how I can support this organization moving forward.
Perfect, thank you. I have been thinking about, musing about Close the Care Gap for quite a while, ever since they announced it. And there are many different ways of looking at that, right? Globally, every year, 20 million people are diagnosed with cancer. And 10 million die of it every year. The 4 main ones are obviously lung, colorectal, breast, and prostate. The rates are increasing in young people, which is another real worry. Where is that coming from? We don't entirely know. Then there's Canada, where in 2021, the estimate was that around 230,000 Canadians would be diagnosed with cancer, and 84,600 died from it. But I think you alluded to it when you were talking about the inequities. Closing the gap in Canada means working toward equitable health care, and this applies to low and lower middle income countries as well. We could talk about the determinants of health, but let's not remove ourselves from the people who are suffering from some of those determinants. So closing the care gap, and I made a long list, so I better refer to it. Closing the care gap means ensuring equitable cancer care for Canadians living in rural areas, Indigenous peoples, immigrants, refugees, and others whose first language is not English or French. LGBTQ2S++ citizens, those who are disabled, visible minorities, and those who live far from cancer screening and treatment centers, and who must travel for care. And I think I gave the example to someone today that Ontario's lung cancer screening program has 4 sites, 1 up north, that's it, in Sudbury. All the rest are south. That's not equitable health care or cancer care. 3 days after our last all-party cancer caucus in the Ontario legislature, Health Minister Sylvia Jones announced that starting in fall 2024, breast screening would start at age 40 instead of 50. But you know, closing the care gap in screening can't be dealt with by decades or another 5 years. There should be no age where it starts, no age where you age out. You shouldn't have to wait until you're 50 now, 40 in the fall, to be screened. And every screening program that we have in the country that I know of so far ages people out at 74. Think about that. Cancer still, even though younger people are being diagnosed, cancer still is a disease of age. It always has been. So what are you telling people when you can't get screened without a letter from a doctor and you're one of the, I don't know, 20% of people in Canada who don't have one? You're going to walk into a clinic and say, I need screening. They'll laugh you out the door. I mean, that's healthcare today. So our policy, and I was just talking with Alicia, because it's their policy too, and we're going to work together on this, there should be no age in or age out. The other message they give to people when it stops at 74, you're old, you don't matter anymore. And for young people, it's you're too young, so you don't matter either. And I actually had, when I worked in breast cancer, a young woman who just had a baby who was diagnosed with breast cancer and went through hell trying to get screening. And she said, you know what? I'm not economically important, so go figure. So closing the care gap means no age limits. You can opt in yourself. And in front of the MPPs, as members of our Ontario All-Party Cancer Caucus, I actually said to them, tell me a case where a woman will wake up one morning and say, I'm going to go for a mammogram just for fun. I don't think so. And they laughed because that's true. There are very few people who would go for screening unless they felt they really needed it. Closing the care gap means that ensuring all those people, 2.3 million in Ontario, who do not have a family doctor. This is the gatekeeper for better health care and when you need it, hopefully. Closing the care gap means not closing screening and canceling or postponing appointments, tests, treatments when, not if but when, the next pandemic hits or the next natural disaster. And as many of you know, or you didn't before, you know now, we did those 5 Leger surveys. We're not going to do any more, hopefully. They're very expensive. And we really stretched to do those. But they were very important because we're the only group, community group, cancer group in Canada who did professional ones. And we made sure that we didn't let the advocates we work with know about them so that they couldn't sort of skew the statistics. Cancer can't wait. And of course, cancer didn't wait. There was a very telling report that came out, and it hit the media, that in 2019, 2020, there were 12 point something, I think it was 5 or 6% fewer people diagnosed with cancer. Those are the people who are being diagnosed late. Those are the people who are going to depend on treatment to stay alive. So the first 3 surveys are thrown under the bus. The next one was, we did a 4th survey on COVID-19 concerns of patients and caregivers when society was opening up with COVID still here. And the 5th one was, and that was called, for cancer patients and caregivers, the pandemic is not over. The 5th one, we looked at long COVID in cancer patients and caregivers. And we actually did take that to our All-Party Cancer Caucus at Queen's Park, and we had 2 cancer patients who had long COVID. And I believe one of them got COVID again since then. and it's called Having Half the Life I Used to Have. What are we doing this year about, besides making sure that as many people as possible know about these? We're working on identifying emergency preparedness plans across the country. We'll start with federal, provincial, territorial, then we'll look at large urban centers, and then we'll look at rural areas. And we're going to read them, and we're going to find out who's responsible. We're going to get in touch and say, hey, you need to add continuing cancer care during whatever happens. You know, one thing that's super important is that we don't go through this again. I know someone in Toronto who I've worked with for a long time. She's very much of an advocate. That's her job. And she knew she was at risk. Her mother and aunt, at least one aunt, had breast cancer. She could not get screened, everything closed. By the time they got to her on the list, at risk or not, she had stage 4 breast cancer. So she's on medication for the rest of her life. She's doing well. But that's not the way someone wants to live. So cancer can't wait, and you know, in many, many cases, cancer didn't wait. So we need to make sure that doesn't happen again. All of you will remember the Fort Mac fire. One thing that they tried to do was when they were evacuating to get in touch with people who were in active cancer treatment and say, go to Calgary or Edmonton, we'll send your files there electronically. And so they did. How successful that was, I don't know, but I have never heard of any other natural disaster where that happened. But everything's electronic now, so why can't we do that? Why can't we take care of people when they have to evacuate, like in Nova Scotia or Yellowknife or Northern Ontario, Alberta, BC, and the wildfires? So my message is we need to listen to what is really going on and make sure that cancer patients and caregivers, and actually people who are in the middle of being diagnosed when everything shut down, that they are not further penalized by more closures of screening. Screening didn't need to close at all. So there are a lot of these available in English and French. If they're all used up from over there, there's more here. Okay, so thank you very much for coming. It's really great. This is the first in-person one we've had since February 2020. So thank you.